If you have pain anywhere in your body which is not going away, you need to watch the following presentation. As we'll learn, chronic pain is not normal, and you don't have to live with it.
I kind of live with neck pain, and the top of my shoulders ache, and my shoulder, you know, here and up into my neck, and then my wrists hurt.
It's hurting right in here, and a little bit on this side, but more so on the right side.
Okay, and how long has that been going on for?
On and off, probably about 6 months.
Basically, my whole right side, going from the base of my skull all the way, and then mysteriously ends up on my left heel.
What you are about to see borders on magic in its effectiveness and speed at reducing and eliminating pain.
The top here, it seems like it went away.
Much better.
What was that?
Much better.
Excellent. So,
It is.
good.
It's amazing.
That's great.
Yeah, feels
Great.
a lot better.
Excellent.
Makes me feel like I'm coming alive again.
Good. Great.
Don't feel nothing. No pain.
Really?
No pain.
That's fantastic.
No pain.
No, I didn't feel like when I bent down. No. Yeah, I didn't feel when I bent down. That was amazing. It is. It was right in here, right up here. I don't feel it.
Isn't that cool?
That's amazing.
Yeah.
I really do not feel any pain.
It feels much, much better.
Good.
Really, it does. Wow. No, it does.
Isn't that amazing?
Wow. I'm kidding. It's like much better.
It's pretty much pain-free, it really is, through there, where it wasn't before.
The testimonials you'll see in this presentation are real people with real successes from just a single treatment of the body restoration technique.
In December, I tore the tendon that runs along my foot, and the pain referred in my ankle. And ever since then, I've had this pain every day when I walk around the ankle. It's amazing.
Wow.
Yes.
Does it feel better?
Yes. I don't have that C cup around my ankle now that it's
That's nice.
constantly pulling.
Oh,
Yes.
Right.
Yes.
Awesome. Cool.
Okay. Thank
Yeah,
you.
You're welcome.
Dr. Eric Berg, chiropractor, nutritional researcher, inventor, author, and past professor at Howard University, has personally trained and certified over 1,100 healthcare practitioners in his methods. Dr. Berg, welcome to the program.
Thank you.
First of all, tell us, what is the body restoration technique?
The body restoration technique is a method of evaluating and treating chronic pain. So anywhere in the body, it doesn't matter if it's in the shoulder or the knee or the foot or the finger, you know, people that can't look over their head when they have a stiff neck. So it's a completely brand new way of evaluating and treating pain, and I've trained over quite a few doctors on the methods over the last 17 years.
I'm sure a lot of doctors who have patients who keep coming back to them saying the pain won't go away.
Exactly. And one of the reasons why it's not going away is because the actual source of the pain is not really removed. And what we found was this. We found that a person's pain is not really where it's coming from. And this is very unique because in school we're taught to treat the area in pain. But in doing this over the last 17 years, we found that that doesn't always work. People keep going and keep going and keep going, and it never fully goes away. So I did some research, and I undercut the whole thing. I wanted to find out what keeps the chronic pain there and gets stuck in the body for a period of time. There's something holding it there.
Some of the testimonials that we just saw are really miraculous. How do people watching us say, you know what, that's me, I might qualify for this type of technique?
Yeah, it doesn't matter where the pain is. We have an interesting way of checking to find out where the source is. And by doing that, you can really see some immediate results rather than, you know, waiting months and months to see any results at all. So it's fantastic.
A lot of people, I think, believe chronic pain is just normal. You get it, and it's just something you got to live with. How do you change that type of thinking?
Chronic pain is absolutely not normal. The body has certain healing cycles that it goes through, and your body should heal itself or self-correct itself. And the reason it can't is because there's something stopping it. So what I wanted to know was what turns an acute injury into a chronic injury, and why does it get stuck in the body for years and years and years and years. So that's where I did my research, and I found something huge. And when you apply this technique to those areas, you can get the body to self-correct at a very, very fast rate.
How do you actually define pain?
Pain is a very unpleasant sensation, and it's basically a warning sign because your body is telling you there's damage there and stay away from the area. So if you had a knee pain, for example, the body's giving you pain signals to prevent the recurrent injury of that knee. So that's what pain is.
So when people say, what makes it chronic? Is it going from I had something this week to it literally something I'm experiencing for 6 months?
Normal pain, you should basically have a pain, and the body should have an inflammation cycle. There's 4 cycles, and you go through it, and you should be healed up. But what's happening is they go into the chronic phase, which is months and months and months and years and years and years. It never fully heals.
Why is it that people often, they'll go into a doctor's office and they do get treatment and it goes away, but in the long term, nothing really seems to work? It's always something that kind of comes back.
Because the actual source of the pain is never removed. The pain is a symptom, and you treat the pain without the source, and it keeps coming back over and over and over.
What about the person who comes in and says, look, I have a knee injury, and ever since then I've had chronic pain in my knee? I mean, sometimes isn't the cause where the actual pain is occurring?
Partially. Because what happens when you injure your knee, and this is what I found out the hard way of doing a lot of type of research into this area, I found that when you injure your knee, you not only injure your knee, you create another blockage in another part of the body. And if that's not corrected, the knee pain will only partially heal. And so by checking the entire body to find out what's holding it in place, you can remove that and allow the body to really stabilize to the point where then it doesn't come back.
How do you go about fixing something like that? I mean, I know they need to come in for a consultation. I mean, what do you do that actually helps pinpoint where all the problem areas are?
Well, we have a very interesting way of evaluating not just the injury, but the acupressure point systems in the body. Now, we don't use needles, and I mean, acupuncture has been around for quite a few years.
5,000 years?
About 5,000 years, right. So it's one of the oldest known forms of healing. In fact, they used to heal all sorts of problems with treating acupuncture points.
Why is this something, though, that you think the medical community in some cases has gotten away from?
Well, I think what's happening in like Hong Kong or China, I've just certified 3 doctors from there, and they use it in the hospitals there, but in America, we're not quite there yet. But it is a valid treatment. It's been around the test of time, so it's something that should be looked into. I mean, it's...
When you look, I'm assuming, I don't know how many people you've had actually come into your office. Again, we've seen a lot of great testimonials here. What are maybe the main causes of chronic pain, or the main symptoms, I should say, that you see with a lot of folks out there?
Well, you see a lot of knee problems, right? And you have a lot of low back, neck, carpal tunnel syndrome, problems in the shoulders, in the feet, and the hips. And so these people have these problems, and they're coping with them as best as they can.
And what's the cause of most of these? Are they injuries, sports injuries? Well, what's the cause of most of them?
Initially, most are. But the actual, when you injure yourself, you create 2 different problems. You create a problem within the acupressure point system that then interferes with the normal healing cycles, because when the brain connects to that area, it's supposed to actually create a loop and a healing. Well, that doesn't actually occur. So what we do is we evaluate that whole area and get the body to actually self-correct on its own. So it's more of an internal correction rather than treat it from the outside in. We treat it from the inside out.
You have a chart here that really shows all the different acupressure points, or a lot of them from the waist up, I should say. I mean, how many acupressure points are there on the human body?
There's over 500.
Wow.
Now, let me explain. There's a lot of confusion as what an acupuncture point is, and we don't use acupuncture in our clinic. We don't use needles. We use the points, though. So I developed a technique that uses the points in a different way. And we have a way of checking all these points. Let's say you had pain in this shoulder right here. We can check the body, and we usually find, in about 95% of the cases, that the actual cause of the problem here is somewhere else. And that's very unique, because this explains why people can't get rid of the problem, because what they're doing is they're treating the injury, the pain, not checking the whole body. And I can't tell you how many people that have headaches, for example, the problem is not in the head, it's somewhere else. So knee pains could come from your kidney acupressure point. So we assess all the points and find out what is the one thing that shows up that's weak, that's creating all the problems. In fact, here's another chart here. If this is the skin right here, and all these organs are connected to these points, these little points are little mini fuses, like in your house you have a fuse. And the electrical flow that goes through the fuse, if there's a surge, it'll cause the house to go blow a fuse, and you'll get dark in a certain room. So the same thing happens with the body. These are almost like Christmas tree lights. So when one blows, it can create an interference or a blockage
all the way down
else.
the line, basically. Yeah. When somebody comes in and says, I need a consultation, I want you to find where I'm off, how long does it often take to do something like that? Is it easy to diagnose in many cases?
It's actually, I narrowed down the technique to a very streamlined way to find the root of the cause, I mean, right away. It doesn't take a long time. What you have to do is you have to look at the whole body, not just one little area. So we check the entire body, and we check all the points and find out where's your weak link, and then we actually stimulate it, and you can see results very quickly. If you get the right cause of the problem, you can see results immediately. If you get the wrong thing, you'll get no results.
And actually, as we've already seen, there's been a number of great testimonials, but I want to show our viewers even more from people who have come to you and come away going, wow, this really works. Take a look at these comments from patients, and remember, these before and after comments were from just one treatment.